All right. Good afternoon, everyone. Thank you for being here today. I'd like to talk to everyone today about medication errors and prevention of those errors. We recently had a severe medication administration error in our very own hospital. This error did reach the patient and caused harm. And, ultimately, our pillar of this hospital is zero harm. So what happened? On December 9th, this year at 5:30 p.m., a 4-year-old pediatric female patient was admitted to our burn unit for 20% surface area, third-degree burns to her face. During her stay, every third day, she received dressing changes, and during those dressing changes, she was administered oxycodone. So on those days, that controlled substance was used. So after a week, the patient's mother, she noticed her daughter, experiencing shallow breathing, after each dressing change. Obviously the physician and nurses were notified, and upon further examination and testing, it was revealed that the patient had CO2 retention and hypoxemia. With that, the physician on shift did some further digging and found that the patient received 5 times the regular dose of oxycodone. It was not the pediatric dose that was administered, so the patient received 5 times the pediatric dose, which is obviously a huge error there. Thankfully, the error was caught in time for the patient to receive multiple doses of naloxone or Narcan. So her breathing improved and intubation was avoided. And then after additional week of monitoring, the patient was safely discharged home. So what went wrong? The physician ordered the pediatric dose of oxycodone. However, the pharmacist dispensed the adult dose. The nurse who administered the medication did not check the medication label to validate for a pediatric dose. And so, in this case, we saw, human error, process error, and then protocol error. One of the most important guidelines that we adhere to and that must be adhered to is the 6 rights of medication administration. So before administration of any medication, not just controlled substances, we must validate and verify the right patient, right drug, right indication, right dose, right time, and right route. So 2 of our staff members, should have taken these steps. Pediatric dosage was not verified, and this directly affected one of our patients on December 9th. So how do we fix this? The 6 rights already exist for this very reason. As a hospital, we put in place a process where staff members, must validate all 6 before administering. So after receiving the medication from the pharmacy, the nurse must validate all 6 within the patient's EMR. Pediatric patients are at a much higher risk for medication errors, due to just the frequency of their doses being different than that of adults. So a new process or protocol that we'll put in place is, we'll have a new template within our health record system. It'll be created and have specific checkpoints for pediatric risk. If the medication is for a pediatric patient, a new vial sticker labeled pediatric must be printed out and placed on the drug vial. The patient's EMR chart will be locked until an updated label is printed. Of course, there's workarounds, with automated systems. So it is crucial that we rely on procedural compliance. So holding, all our members accountable and following protocol and procedures is where, is what's very important here. So as a staff, we need to be hyper aware of the pediatric risk for medication errors. And then in addition, obviously there's a risk for all patients, adult patients. So we're going to implement a few new trainings, that just kind of go over pediatric dosages and medications and what that looks like, just to refresh us there. And then, of course, we'll have to implement, what we've learned, through this event, and implement some of our changes. So I appreciate y'all's time today, and let me know if you have any questions. Thanks.